Welcome to If You Know Someone with a Vagina,
or as we like to call it, IYKSWAV.
IYKSWAV. Hi, I'm Sandi.
And I'm Beth.
We're recently retired nurse practitioners, excited to bring you a podcast filled with informative insights, compassionate discussions, inclusive perspectives, and expect a healthy dose of humor. Whether you have a vagina or you know someone who does, this is the podcast for you.
The content of this podcast is provided for general informational and entertainment purposes only and is not intended as, or should it be considered, a substitute for professional medical advice.
Today's episode is, what's that smell?
Vaginal odor. Let's talk about it.
Yeah, let's. Here's what you have to look forward to in this episode.
Well, is there a normal vaginal odor?
And what's an abnormal vaginal odor, and what should I do about it?
Great topic today, Sandi.
Love it.
So before we can start tackling the topic of vaginal odor, we can't escape once again mentioning the vaginal microbiome.
I know. We're all going to get this down eventually. The vaginal microbiome, which I have such a hard time saying that I have to highlight and bold micro. So I'm not going microbiome. That's my way.
Sounds cooler.
Totally cool. The vaginal microbiome refers to microorganisms, meaning they are so small you can't see them without a microscope, but they're naturally living in our vaginas.
Wow, they play a big role in maintaining our vaginal health and protecting against infections.
Yeah, the dominant bacteria in our vaginal microbiome is called lactobacillus.
Lactobacillus produces lactic acid, which helps to maintain an acidic pH around 3.8 to 4.5.
Yeah, I don't think that's necessarily common knowledge, that the healthy natural environment in our vaginas is acidic, and that's because it helps to inhibit the growth of those harmful microorganisms, making it inhospitable. Oh, sorry, Beth. Did I just freaking spit on you?
Love that.
So sorry.
So Sandi and I came up with an easier way to think of the vaginal microbiome by visualizing a carefully balanced garden.
Oh,
Doesn't that sound nice?
nice.
In a regular garden, you have a gardener, soil, and weeds.
Yeah, so in your vagina garden, the role of the gardener will be played by lactobacillus. They protect us against harmful invaders like weeds, meaning the bad bacteria or candida that causes those yeast infections. So take a listen to Yeasty Girls when you get a chance, one of our other episodes.
Good one.
Yeah.
Good plugs.
Oh, yeah. But the soil is the overall environment in the vagina, like pH or moisture levels. So the gardener's job is to maintain the right soil pH, that acidic environment, and prevent the weeds or the bad actors that I was talking about from taking over.
So in our garden analogy, a well-tended garden with healthy plants, controlled weeds, and rich soil leads to a thriving ecosystem.
Just like in your vagina garden, a balanced vaginal microbiome supports overall vaginal health and a sense of well-being.
I love well-being.
Me too.
Dimples, your softness or your wrinkles, they are beautiful to me, beautiful to me. I am beautiful.
Part 1, the patient perspective. And duh, we're patients too.
Has this ever happened to you? Let's get personal.
Hey, Sandi, not to pry, but have you ever had abnormal vaginal odor?
Me? What about you?
I've never had an odor where I had to go to a provider or see somebody about it, but I have like my sweaty, regular after working out at the gym.
Yeah.
Some stank going on, but
Okay. And what, you showered?
shower, wash my clothes. It's back to normal, but
Bob's your uncle. Or Bob's your vagina.
no, honey, it's not the name of my vagina.
Oh, okay.
Bob is not the name.
It's not a Spice like mine is.
No say name. Is that Old Spice?
Oh my God,
That's me. That was me. I'm sorry.
That's getting truer and
Sandy's
truer.
young and young and vibrant.
I am the oldest of the two. That's true. Or should I call it Cobweb Central? That could be true as well.
No,
At some point.
that's another episode.
That is a total.
All right, we'll get to that one.
Okay, Beth. If you're sure this will help someone else,
Absolutely. Come on.
it freaking better, because I'm going to talk about my worst vaginal odor that I had, which I believe God gave me so I would be able to relate to people. Once I became a women's health provider, it's like, I'm going to give you everything that is not going to hurt you too bad, but just so you can relate to your patients. And so
you can be. I've been there.
yeah, I've been there, and I'm gonna be saying this and talking about it and treating it in the future. So thanks. Yeah, it's like, oh my gosh. But so this was like in my 30s. So I basically knew squat.
About your twat.
Yeah, sorry. Yeah, no, it's perfect.
Andy's line. I swear.
No. We don't have time.
Sandy.
I knew squat about my twat. But okay. Yeah, we'll go back and edit that later, won't we? But when it did happen for me, my feelings about it were freaking shock. What the hell is this?
Well, yeah.
Because I'm in my 30s. I had never had it before. I already had my 2 kids, and I was embarrassed. And I was at home, and got home, and I was like, what is going on? Because I could smell the dreaded fishy odor coming through my jeans.
Yeah.
I'm like, what the hell? And it just took me right back to high school, where I heard the stupidest joke, but I would...
Oh, you got to tell it now.
Okay.
Yeah.
But it confused me, because I'm like, what? So yeah, somebody said, what did the blind man say as he was walking past the fish market?
What, Sandy?
And they said that the guy said, well, hello, ladies. And I was like, what?
That's so bad. Yeah.
It's
offensive.
It's offensive. And I always felt like, well, why doesn't mine smell like it? Like it never did. It's like, is that what I'm supposed to smell like? But no. So when I got it, I was like, ew. And that was not a nice joke. Looking back, I was like, oh my God.
Made you feel shame about your vaginal odor.
Totally. Because I was mad. I was like, well, what am I? It's always like, what am I being punished for? Why did I get this? What have I done wrong? So I was like mad and ashamed and embarrassed. So it's just all these feelings going through me, which I hated. But then I thought, well, I do have an extra sensitive sniffer, because
she does.
I do.
She does.
Even worse sensitive now than it was then. I mean, but growing up in a household where there's an alcoholic living there, I think other people can relate. Like, you can smell it, even if they try to cover it up with mouthwash or Altoids or whatever. It's like, nope.
Well, it's like a defense mechanism. Right?
Yeah, it
coming
puts you in a fight or flight mode too. It's like, oh, I gotta go to my room now or whatever, and just get out of sight. So smells were also instrumental in my 20s, because I had to go to the laundromat. And it was like, I hated going to the laundromat, spending money.
You're broke. I was broke in my 20s.
Everyone's broke in their 20s, pretty much. Most of us were, even though I was a nurse. This is going to really date me, but I made $11.50 an hour.
Wow.
As a registered nurse. I know, and I walked both ways uphill in the snow to school. Not. But so in my 20s, I tried to save money and I didn't want to go to the laundromat. So I started, as we all do, started sniffing things to make sure.
Can I wear this again?
Yeah. So the panty.
Yeah.
The jean. The armpits. The pits. It's like, yeah, I can get a second plus use for.
Oh, Lord, no.
Yeah. Yeah. No. Yeah. That's your Beth Musky smell.
Yeah, believe me. There was no re-wearing.
We've all been there. Yeah. Or I'm just going to the gym. It's okay if it already stinks, right? But your normal, like, fresh sweat, like your normal vagina smell, can act like a pheromone.
Oh,
so
yeah.
It's actually right. It's like this chemical response that you send out, like it or not, and it can attract partners for you. They're like, oh, I love
or
her.
unattract too.
Or, oh, yes,
some people are turned off. Some people are turned on, right?
Yeah. So you're like, oh, good, you don't like my smell because I
right?
you.
I got more where that came from.
I know. Yeah. Sorry. Exactly. But that just reminded me of, like, when you get married and stuff, or just, sleeping with a regular partner, let's say, you do get used to, like, their smell and stuff, even like morning breath. So my husband, we usually kiss in the morning, hi, good morning, whatever. And so one morning he was like, that's off. I'm like, what? Oh, do I have more
breath in your vagina?
We're keeping it up top. Okay. Just for now. And I got his I always get his permission before I tell a story or that story. Yes, I don't want to, like, spring it on the world without asking him first. So I'm like, oh, really? My breath is out. He goes, no, it's not bad morning breath. There's something, like, bad that's not normal. And I actually had a dentist appointment coming right up anyway. And so when I went to the dentist, they're like, yeah, you have a cavity.
Right? It's your body telling something is off. Yeah. So same with the vaginal odor, though.
Right. Sniffed out my cavity. Like, but I would say that's God's little joke. Like, you can't smell your own bad breath.
Yeah, right.
And you can't really smell your own vagina until something happens, right? Mm-hmm. So what you can do is wash your hands, put your fingers in your vagina, take them out, smell, and nothing's off. It's like, okay, that's my normal smell. Wash your hands again. Bob's your uncle again.
Stop calling my vagina Bob.
That's some old saying that I can't get rid of. Yeah, it's always on the tip of my tongue.
Yeah, that's great. Yeah. To get to know your own smell.
Yeah.
That's a totally good thing. So for you, though, the question is, how did the fishy smell actually reveal itself?
I did not say that, did I? I just smelled it right. You're right. Thanks for saying that, because I was thinking, yeah, I was at home. I smelled something through my jeans, so I had to take them off. Take off my panties, smell the crotch, and I went, oh, God, no. And then I was panicking. So I was like, what? And there was, like, a lot of wetness, too. So a little bit more, like, thin, watery kind of discharge, too. And I'm like, oh, no. So I'm like, where do I go? Was my first thought. So I was working at the clinic at the time. Yeah, so didn't want to go there because I'm like, oh,
you know everybody.
I know, and everybody knows me. I know them. And how terrible that I felt uncomfortable. I'm just like, well, shoot, this is nothing to be ashamed about, but I was. I just was.
I think that's a natural response. You do.
Yeah, I know. It's too bad that, well, and then I thought, oh, I'm sitting in the waiting room and what, can everybody smell me?
Oh,
Because
yeah.
I could smell it. I just confirmed, holding stuff up a little closer. But so there was a midwife that I knew that started her own clinic. And I'm like, thank God I called her and she could get me in the next day. So I went in, she examined me, and she didn't even do any tests. I mean, this was a long time ago.
But she knew just from the odor.
She's like, oh, yeah, you've got BV, you've got bacterial vaginosis. I'm like, okay. So that's not an STD.
No, and it's the most common bacterial infection of the vagina.
Yeah. I just looked something up that said, like, probably 1 out of 3. So like a third of us probably end up getting
Wow.
at some point in America. And so she gave me some antibiotics, and then she's like, no alcohol. So there's a certain antibiotics you cannot drink alcohol, or it kind of works like antabuse. That one, like you drink it, you're gonna throw up. And it's like, I swear, almost every time that I prescribed it, it's like, oh, I got my cousin's wedding this weekend. So,
Well,
I don't know.
can have alcohol. I can.
Yeah.
Fishy odor.
It's up to you. There are some, there's another antibiotic you could take, but it's like a little bit harder on your gut. And then there's vaginal cream that you can insert and stuff, which is a lot more messy. So it just depends. There are choices. So that's the bottom line. But I was like, well, what do I do to prevent this? Is there like a product I can use or something?
Well, just the usual, no douching.
Yes, and don't be a douche. That's the main thing.
Use condoms.
Right, but I wasn't going to ask my husband to use a condom. So I'm like, what else?
Well, limit sexual partners.
Yeah, monogamous at the time. Yeah, for sure. Already doing that.
And then avoiding irritants like scented sprays, soaps. Because, I'm thinking if you're in the waiting room and you've got a fishy odor, your instinct would be to spray a bunch of perfumey stuff down there.
Yeah. It's like you cannot cover that up.
No.
It's like worse. So the combined, it's like it's like the perfume attaches to the fishy odor and then it sends it out into the air or something, but it's awful. A lot of things should not be scented to, like toilet paper and seat covers.
No.
Which they did in the clinic one time, and I
remember that.
I did make a stink over the
nice
over the lavender. I'm just like, why?
Why do we need chemicals in our private areas?
Yeah, not gonna sit on perfume.
That was horrible.
I mean, if they had one really bad allergic reaction to that, they would have been in trouble.
Absolutely.
Yeah, I don't think they talked to the lawyers before they decided to do all that. It's like, who pressed that button?
I don't
to order that.
But Sandy got it taken care of.
Yeah, you know it.
Her and her sensitive sniffer.
That's right.
And then my favorite, of course, is wear cotton underwear.
Oh, yeah.
I love me cotton underwear.
Absolutely. I've been doing that my whole life. My mama raised me right.
Right.
Yeah. I didn't have a lot of underwear because but they all had cotton. They all had cotton crotches. Yes. Yay. So, still wearing those. And then probiotic research at the time was still emerging. So nothing about probiotics at that time in the 1990s that was on the forefront. So nobody was saying, hey, do this, do that.
So what did you do?
So I was disappointed. I'm like, really? There's nothing else I can do? Because I feel like we just went down the list and I haven't done anything like that. So I'm not sure what happened. So I just went home and started combing the internet myself. And I found a product called Refresh, REPH. And So it's a gel, has a thin little applicator. You put it in, push in the gel, throw away the applicator. So the gel mostly had lactic acid in it. And so when I read in, well, how does this work? It just clings to the walls of the vagina and then kind of slowly sloughs off. And then it is supposed to restore you to a healthy pH.
Like we talked about in the vagina garden.
Yes. So one of the bad actors got in there, and it's the Gardnerella bacteria is the main bad actor for bacterial vaginosis, and if that takes over, then it releases the smell and the odor. So with the Refresh, use it twice a week. It helps prevent your pH from going to alkaline and keeps the soil healthy.
So it's like a miracle grow for your garden.
For your, yes, exactly. Miracle. I like that. I love it. So I just started using it like twice a week in my 30s, and I just, except for when I was on my period. Because then it just clumps up and it's gross, and there's no need to, you can't fight the pH of the blood while you're trying to keep it healthy. Just let the self-cleaning oven do what it's supposed to do during the period. And then I would use it twice a week. And I never got BV again during my reproductive years.
Wonderful.
Let's call them. Yeah. So then I Googled what else was in the ingredients. So it's not always easy to find because they kept changing the ingredients, and then I didn't.
As knowledge of the vaginal microbiome probably changed.
Yeah, maybe there's this or that in there. I'm like, oh really? Oh, I didn't know that they changed it. But when I had it, was using it, I think it had sodium bicarb in it. So it's like baking soda that you absorb odors. That's what it does. So it's like something, most of us open it up, we put it in our refrigerator, but it's the opposite of what you want in your vagina because it's alkaline. So it's like, why would I want to put baking soda in my vagina? The vagina is a self-cleaning oven, but it's not a refrigerator. So, remember that.
Oh, that's a good one.
But what was cool about when I finally started being able to tell people about it. Before I did women's health and I was using it already, I was afraid to tell people because they sold it at Walmart in this small island. And I'm like, I don't want them to run out. It's mine, me. It's all for me. But so I did tell my patients. Okay. And then when they used it, even the ones that had recurrent, when they started using it regularly, I didn't see it.
Oh, wonderful.
And for that again. And then they would come back and I'd say, oh, what happened? Because I really wanted, that stuff doesn't work for you, maybe. And she's like, oh, I haven't used it in a couple months. I'm like, oh, okay, well.
There you have it.
There you have it. Yeah.
Well, that was one type of vaginal odor, but we should discuss the spectrum of vaginal odors.
Indeed, we should.
From musky, tinny, bleachy, yeasty, fishy, rotten to foul.
It sounds like the seven dwarfs.
Yes. Or if we're sticking with our vaginal garden analogy, what, 7
garden gnomes?
That's hilarious. That's hilarious.
Yeah.
Musky, Tinny, and Bleachy in a cottage with a garden and plow, avoiding their evil cousins. Yeasty, fishy, rotten, and foul.
All right, number 1, let's talk about Musky, the one I'm familiar with.
Oh, yeah. Just think about Beth.
My stanky underwear.
You realize they named cologne after the Musky, so it's not that bad. Remember Musk for Men?
Oh, yeah. Wow.
It's a total big seller, popular in the nightclubs and the discos, if you will. So it can Musky can actually attract a sexual partner.
So a musky odor, is perfectly normal.
Yeah.
And can vary based on how much you sweat and, how long you sit in your sweat.
Yeah, that changes it for sure. So just like, our pits, our vulva, the outside area that protects the opening of the vagina has sweat glands. And so that creates moisture, which can lead to the strong odor.
Wow. Even strong-smelling, pungent foods like onions and garlic can make your vagina smell like them too.
It's good for some folks,
right? I like garlic.
I like the garlic.
That's because the food's scent gets excreted by sweat glands all over your body, including your vulva, and can also be present in your vaginal fluids.
Yeah. Well, and also in your pee. So, yeah, you can also come. This comes into play, with asparagus.
Oh, yeah.
Yeah. And it, which can give the urine a strong smell, and that urethra, the opening from the bladder to the outside world, that meatus there, when it comes through, it's right next to the vagina. And so if you have that asparagus smell, it'll just smell like asparagus. The vagina smells like it when it's really the urine.
Some people say they don't get asparagus urine.
Oh, so it's funny. I read something. It's like everybody gets it.
Really?
But not everybody can smell it.
Oh.
Isn't that weird?
That's fascinating. I could definitely smell it. I'll tell you.
I've got the superpower too, as you know.
Yeah, super sniffer.
Super sniffer. And, if you have really good friends, like my girlfriends from high school especially, tested this notion because I was on a girls' trip when I read that. So awesome. Let's go buy some asparagus. Yes, we're eating. Let's all eat asparagus and then see who can smell the pee. And the one that can't smell the pee, that I'm going to go in and see if I can smell the pee. And I could smell the pee.
Okay.
So you liar. They do have asparagus pee. You just can't smell it.
Well, good for them.
Yeah.
I don't want to smell that. But,
right. It's a curse, not a gift.
Right? So for those of us, I'm talking about myself here, with overly musky odors, here's some prevention tips.
Awesome.
Using gentle, fragrance-free soap on the vulva only.
Yeah.
Do not insert soap directly into the vagina, by the way, because that can actually affect the vaginal pH.
Yeah.
So you want just water or a very gentle, non-smelly soap.
Yeah, please don't put it inside the vagina because, as Beth just said about the vaginal pH, if you alter that, that can lead to infections and the unpleasant odor.
Yes. Yeah. And then, like me, I change my underwear more than daily, or when you're working out or when it's sweaty or soiled. And then, of course, take a shower after sweating, as that trapped sweat can increase the vaginal odor as well. And then if you don't have time to take a shower, you can just take a washcloth in between showers and gently wipe down around the area.
That's a great idea.
It is a great idea. Yeah. And remember, don't use smelly, stinky soaps, And then my favorite, ta-da, breathable cotton underwear.
Hey. Everybody's doing it now.
Right? We love those granny underwear. Because the cotton is less likely to hold moisture close to the vagina. And that makes it more difficult for the bacteria and other sources of odor to build up and produce a strong smell.
Exactly. So,
right?
Yeah, catch it. I mean, catch on. Just kidding about catch it. Catch the wave of the cotton underwear.
Okay.
Number 2, Tinny. Mm-hmm. So if your vagina's scent is vaguely metallic, especially during your period, that's totally normal.
Okay.
That's just kind of what that iron in your blood smells like.
Yeah.
And if something smells that way, but you're postmenopausal, which means that you haven't had a period for over a year and you're of the age. So sometimes you can have like an IUD or an Explanon or something where it's keeping you from having a period, then that's different. But if you don't have any hormones preventing your period and you haven't had a period in a year, that's postmenopausal. So if you have any bleeding after that,
red
flag. Go see someone right away. Not, oh, it might go away. No, go see what it is.
Yes, absolutely.
Yes, who cares if it goes away for a little bit? You still need to know what happened and it might come back or whatever. Just go in for sure. I can't, emphasize that enough because it could be, cancer. That's always, let's prove it's not cancer first. Right. Yes.
But if you're normally getting your period, a tinny odor is okay.
Totally normal. Yes. So in order to kind of prevent the smell from coming out where you can smell it, internal products, so like the menstrual cup or tampons that we used to, that was really our only choice back in the day. The moisture of maxi pads and reusable cloth pads can sometimes contribute to the odor because they're, first of all, with the maxi pads and things like that, you're sitting in plastic because you have all that. Here's the adhesive and the plastic, and then the pad sits on top of that. But that's was never my favorite thing for anyone. And some people, some of my patients would wear just a liner every day.
No.
Yes. Can we not sit in plastic?
Wow.
Let's not do that to ourselves, for sure.
So number 3, bleachy. If you smell a chlorine or bleach-like scent after sex, it's probably due to the lubricant or condoms you're using.
Ew.
And they're probably not the best quality product if they're leaving an odor.
Yeah.
So you might want to think, if you're smelling that frequently, you might want to think about changing a product to something a little higher quality. Because you really shouldn't be smelling bleachy after sex.
Like, what?
An ammonia smell, on the other hand, could be related to even a small amount of urine leakage. You may not even be aware of it. I know some of us leak a little when we laugh, cough, or sneeze.
What?
I mean, not us, but we have friends.
Oh, yeah, not me, but Maureen, Donna.
Oh, you
just kidding. You really get close on those girls trips.
Yeah, you do.
And I highly recommend girls trips once a year with your best friends. At least once a year.
Absolutely.
And yes, it's like the best therapy you'll ever have.
It's so true. So true.
So number 4, yeasty. If it smells like you're baking a loaf of sourdough down there, then you probably have a yeast infection. But other signs include that cottage cheese-like discharge and intense itching and burning of the vagina, possibly, and the vulva, so outside the vagina or in the groin area. So listen to our episode called Yeasty Girls for a very thorough discussion on vaginal yeast infections.
Nice plug again, Sandy.
You know it.
Love it. All right, number 5, fishy. So I know Sandy discussed her fishy odor. Sorry, Sandy. But if you notice a strong fishy odor, you probably have bacterial vaginosis or BV.
That's right.
So you may also experience a thin white or gray discharge, burning when you pee, and itching around the outside of the vagina. BV is an infection caused by an imbalance of the good and bad bacteria in the vagina.
And that's one reason I would say if there's itching, it could be the BV, but you may even have a combination of yeast and BV. So going in to get that checked, there are many times when I did a swab, sent in the test, and it's like, oh, they have BV and yeast.
The double whammy.
Yeah. So you need 2 different treatments. So it's kind of like the the gardener versus the weeds scenario, right? Yeah.
So BV is the most common vaginal infection, and it's not actually classified as a sexually transmitted infection, but it is associated with having multiple sex partners.
Yeah, of any gender.
Yeah, and also having a new sex partner and not using condoms. And in general, if you have other STDs, such as herpes or HIV, then you are at higher risk of getting BV.
Yep.
Sexual activity can affect the bacterial balance of your vagina garden. So limit sexual partners and practice safe sex.
Yeah.
Right? And guess what?
Douching.
Don't douche.
And don't be a douche.
I knew you would do that. And cigarette smoking are also risk factors. And once again, don't use scented or flavored products in or around your vagina. Keep that stuff away.
Yeah.
Probiotics may reduce the symptoms associated with bacterial vaginosis. And so you can get probiotics from a pill or just from foods. Sauerkraut, kimchi, yogurt.
Yeah.
Those are some common probiotic foods.
Definitely. And on the other hand, with the fishy smell too, if the discharge is more green, yellowish, also with itching, burning, or pain when you pee or have sex, you could have trichomoniasis. So that's the third most common, actually, vaginal infection but we test for all three of those at the same time when you come to see a provider. So yeast, BV, and trichomoniasis are diagnosed off the same vaginal swab specimen.
Okay, well, regardless, you need to be seen by a licensed medical provider, especially if you have a fishy odor. BV and trich cannot be treated over the counter.
That's right. They cannot be treated over the counter, so please come in. All this being said, Beth, I actually read a recent publication from the New England Journal of Medicine. It was a small but landmark study out of New Zealand, I believe, that found that bacterial vaginosis can be transmitted sexually. So this study findings could shift the treatment focus to both men and women instead of just women only. So we'll have to wait to see if the results are reproducible. So stay tuned. Number 6, rotten. Oh, goodness. So this, Beth, is a super strong smell that resembles rotting food. Is probably thanks to a tampon that has been left in for at least a few days. It's a combination of old blood, bacteria, and vaginal secretions stuck in the tampon, and it just creates an unmistakable odor.
Have you smelled that odor, Andy?
Yeah. It's something you never forget, and you know exactly what it is when you take the tampon out. And I've done that many times. I've had friends that have left their tampons.
I've had friends tell me.
Too.
Yeah.
So, yeah, it's more common than people think. So
I think it is.
If it's happened to you, don't think that you're a total moron, because it happens to every walk of life. And it's so, it's sad because they'll come in and just, like I had a lady who didn't even smell it. And she just said it is so irritated in there. And so when I put the speculum in, and then I saw it, so I pulled the tampon out, and then you just could smell it so strong. And so I was putting it in the red bucket, and I put it.
Usually, how many days do you think it was in there?
She said she was having symptoms for like 10 days. Oh, whoa. I know.
She's lucky she didn't get anything.
Yeah, toxic shock syndrome or something. She had no fever or anything, but just this uncomfortableness. And so when I took it out, so I usually put it in a specimen cup with the lid on it, like you do with it. No, it's not for showing down.
Sorry.
And then I put that in the red bucket because it's just it's like all roads lead to Seinfeld. So, that's that Seinfeld episode where Jerry takes his car into the mechanic, and then whoever was driving the car or whatever was sitting in it had the worst BO. And it's like, he could not get rid of the BO smell. So I think he ended up selling his car or something. But when I took the tampon out of this poor lady, she was like, oh my God. She goes, and now all of a sudden she could smell it. She goes, is that me? And I was just like, my heart was breaking for she. I know. I'm like, yeah, but it's all going to get better now. So most of the time you just take the tampon out and you don't need.
Yeah, actually, my friend who had left hers in just realized it was her tampon.
Yeah. Oh, good. And so she could take her own out.
Yeah.
So, yeah, and it depends too on the length of your vagina because, you could have a deeper vaginal canal. So it can be anywhere from like 2 inches to 7. So, and then depends on, what, like if you did have intercourse and that's why it's so far back there and their length as well. So you may not be able to reach because obviously there's not going to be a string sticking out anymore.
Pushed in.
It's way too far. Yeah. So you have no reminder.
Feel it though.
Yeah. Well, there's already a lump back there called the cervix. So you don't know that that's not the cervix.
Or if they thought, maybe it was a diaphragm.
Right. Or they, depends
somebody you hadn't had sex with before. They would know what your vagina normally feels.
Yeah. Sometimes they don't stop and have all the conversations.
No judgment.
No judgment.
We've done situations people get in.
Yes.
And forgetting a tampon that happens.
So no shame.
No shame.
No shame.
Shame. Number 7, foul. So this is not as specific to a cause as fishy and rotten, but a really foul odor means there's probably something really serious going on.
Right. So especially if it's accompanied by like fever or pain, especially in the lower abdomen, painful sex that's new, or some really unusual discharge.
We don't want to scare anyone, but please, we want you to be aware enough so that you don't hesitate to be evaluated by a licensed medical professional.
Yes, please do. Part 2, survey results, your perspective, and your partner's too.
Survey says... So we did a survey about abnormal vaginal odor and had almost 50 responses.
Yeah.
Over half of the respondents were the people who experienced abnormal vaginal odor and the rest were the partners.
That's awesome.
Yeah. So, you know what? It was a common occurrence.
I believe it.
The majority of our respondents actually experienced abnormal vaginal odor on more than one occasion.
Yeah, that makes sense.
And
that's too bad.
Some other information we got, most of them sought treatment from a provider, although most responded that they tried over-the-counter and home remedies as well.
Oh, no.
And guess what? The majority of the respondents said they felt embarrassed about talking with their partner about their normal vaginal odor. Yes. Also, I remember some of the respondents that were the partners were embarrassed to tell their partner if they had noticed the smell first.
Yeah. So it's going to make hard on both people.
Mm-hmm.
Yeah. Yeah. And you know who can relate to that?
Yeah.
That's me. Yeah. I was so embarrassed. And it's interesting because for the BV part, I did talk to my partner. And if you listen to Yeasty Girls, didn't talk to my partner with that one. That one was in my 20s. So I think a little maturity and, the closeness to the partner.
Well, you know what else? It's that's why we're so needed, this podcast. That's what we're encouraging. We're encouraging discussions.
Yeah, we really are just want to help. And I mean, it's one thing to help a patient, one patient at a time, but to be able to reach out to more people our listeners, friends, and hopefully we can reach more people and help more people.
Because you know what? You're not alone in this.
No, you're not.
Quick summary, friends. A healthy vagina usually has a slight scent, but choices of food, drink, hygiene practices, and clothing can all affect it. But as you heard today, Musky, Tinny, and Bleachy are normal variations.
A stronger odor like yeasty, fishy, rotten, and foul can indicate a health problem that needs medical attention.
And as always, if symptoms persist or worsen, consult a licensed healthcare provider.
Yes, please.
Musky, Tinny, and Bleachy in a cottage with a garden and plow, avoiding their evil cousins. Yeasty, fishy, rotten, and foul.
Okay, now that you have our What's That Smell jingle memorized.
And don't forget to share it with friends.
I'm sure they would love a new earworm.
Well, it's a good one.
Yeah, I love it. But if you are experiencing a vagina issue and need advice on how to find the right provider and what to expect during a pelvic exam, you need to listen to our other episode called The Pelvic Pokey, the ins and outs of your pelvic exam.
Oh my gosh, listeners, Sandy gives some great, valuable insights for anyone who wants more information about what goes on during the visit, whether you have had a pelvic exam before or not, whether you're anxious or not.
Yeah, I really just want to empower you guys so you feel more prepared and in control of your healthcare experience. And I'm sure most of you will hear some unique tips that you've never heard before.
I'm telling you, check it out. The Pelvic Pokey, the ins and outs of your pelvic exam.
That's right. I'm Sandy.
And I'm Beth.
And if you have a vagina or know someone with a vagina, then please like, share, and send them our way. Go ahead, spread it around.
Feel free to spread it.
You can find us on all podcast platforms like Spotify, Apple Music, and YouTube. Bye, everyone.
Thanks for listening.
Now that you have our What's That Smell jingle memorized.
And don't forget to share it with your friends.
I'm sure they would love a new earworm.
It's a good one, though.
Love it. That was so good.